familiarized with the magnetic resonance imaging device we use for clinical imaging. To recognize a T1 sequence, the liquid inside the brain is very dark. So in this case, in the magnetic resonance imaging, we will say that a dark image is a hypointense image. So for instance, the ventricles are hypointense and the white matter looks brighter, and we will say that it has a more hyperintense signal. And the cerebral cortex, the gray matter of the cerebral cortex, looks gray, in fact. So in a T1 sequence, we will say that the white matter looks whiter, the gray matter looks, in fact, of that color, gray, and the water looks very dark. So we will say it's hypointense. In the middle image, we can see another sequence. This is a FLAIR image. So in the FLAIR image, the water in the ventricles is still dark, so it's still hypointense. You can see a very clear example of the liquid inside the eyes. So the water is hypointense, but in this case, some lesions may see hyperintense. This is a case in which we can see a brain tumor that is affecting the brainstem. This is a very important lesion because it can lead to a pathological problem that is the Hydrocephalus. This is another sequence. On the right, you can see T2 sequence. The water looks very bright. So we will say that the liquid or the water inside the ventricle is hyperintense. So if you see a brain lesion with that signal, a bright signal, a hyperintense signal, you can make the inference that likely it has water inside the lesion. And that may be the case in old lesions, or it may be the case in degenerative disease leading to atrophy. Another principle is that we can use contrast. For example, this patient has a brain tumor that is affecting the region of the hypothalamus and also a little bit the region of the mesencephalon. On the right side, we can see the contrast, which is surrounding the lesion. And so it allows us to make correct demarcation of where the lesion starts and where it ends. This is very important for surgical purposes, also for the characterization of the lesion, leading to a correct diagnosis. Another example, by looking at MRI, we need to see the same lesion in different sequences. So we can understand the behavior of the lesion according to different sequences of the MRI. Above, we can see this is a T2 sequence. Remember that the water looks very bright, it's hyperintense, and we can see an extensive lesion in the frontal lobes. In fact, this is a bilateral lesion in the frontal lobes. This was a lesion that is the result, in this case, of a drug abuse. And you can see in the FLAIR imaging, in the FLAIR sequence, the same lesion, but with more clarity because the contrast is better. And we can see that the same lesion is hyperintense. And now the brain cortex looks gray. So we have a better contrast. Some clinicians even start looking at the MRI through the FLAIR sequence to see if there's anything. And if they find something there, perhaps they would look at other sequences to see the correct behavior of the lesion.